Welcome to today's episode of Advancing Healthcare Through Simulation. I'm your host, Lisa George, and today I'm excited to welcome Roger Crowe from Bow Valley College. He's a leader in healthcare simulation and VR-based nursing education. And in our episode today, we'll explore how simulation is transforming workforce training, improving competency, and preparing healthcare professionals for the evolving demands of the industry. Roger, thank you so much for joining me on today's episode. Really excited to dive in and talk more about simulation and how it supports workforce training. But I thought maybe we could start off with you just telling us a little bit about your background in simulation and where you've gone on your journey through this experience. Sure.
Okay. So I actually came from the transplant community. That was my, preparation for simulation organ transplant, solid organ transplant. And then was recruited by a company called CAE, Canadian Aviation Electronics, who basically invented flight simulation. That was their segue into it. And in the early 2000s, realized that they had all this expertise in working with simulation in high-risk environments, commercial aviation. And so they moved into healthcare simulation. And in about 2013, I joined them and ended up spending about a decade there, seeing simulation centers all over the world, what works, what doesn't, how different countries and different cultures treat simulation, how it's used in different areas of healthcare. It was very, very rewarding. And then about, a year and a half ago, came on here at Bow Valley College here in Calgary. And my current role has me as the manager for healthcare simulation and technology.
Okay, great. So you have worked with a number of institutes, educators. You've seen a wide variety of simulation. And I'm wondering, maybe if we can start with what it looks like at Bow Valley College. How do you integrate simulation, or how do you see it being integrated into the healthcare education of the programs there?
Sure. So we have a very large, perhaps the largest in the country, I don't know, but it's very large, 1,300 learner practical nursing program. We have a healthcare aid program that's doubling in size very shortly. We have a farm tech program. So we offer a variety of programs, healthcare professional programs, and we have a variety of modalities that we use for simulation here. One of them being obviously patient sim. We also use a lot of what's called virtual will, and we use VR on a fairly extensive, way. Also, a consideration is that the scale on which we're doing things. We've got 125 headsets, Quest headsets. We've got 6 sim bays, patient sim bays. So the scale on which we're doing simulation here is very, very large. And that kind of, I think, what sets us apart is that we're doing things on an absolutely massive scale up here. And that we're currently replacing 50%, not 50%. We've got permission by the oversight body, CLPNA, to replace up to 50% of clinical hours with simulation. And currently we're doing 30%.
Okay, wow, that's a significant amount. And can you tell me a little bit more about how you see that supporting, the learners as they're preparing to go into the workforce and, replicating or seeing it as a part of the simulation, maybe ahead of clinical or to replace clinical?
You hit on something really important, and then that is that, the end goal for all this is to graduate and create competent, confident healthcare professionals, whether they're nurses, pharmacists, healthcare aides, whatever. And in order to do that, simulation is a great vehicle, because ultimately the end goal of simulation is to place learners in environments where they will be in those environments in their careers. And so by doing that in their educational process, their response when they get out there in their professional careers, when something happens or something transpires, the response isn't, oh, I don't know what's happening, I don't know what to do. The response is, I know what's happening, and here's what we're going to do, because I've seen that 100 times before. And the ultimate illustration of that was 10 years ago when that fellow, Captain Sully, was flying the plane, hit a flock of geese, was my understanding, lost power, and landed the plane on the Hudson River. Because as a commercial pilot, for example, the first thing you learn, the first scenario you work with is a loss of power. So when that happened, his response wasn't, I don't know what happened. I don't know what we're going to do. It was, I know exactly what's happened. Here's what we're going to do. And everybody walked away without a scratch. So the idea with simulation is to create that same environment. At CAE, we call that the aviation model. And it's a model around the acquisition, the retention, the validation, and the ongoing maintenance of skills. And healthcare simulation, I think we're very much working in that direction towards kind of replicating that aviation model.
You mentioned VR. This is really starting to, catch hold and excitement in a lot of different training. Can you tell me a little bit more about how you see that really enhancing the simulation experience for learners and professionals, and what benefit that has?
Yeah, you raise a great point. That's a question everybody is asking right now is, can we incorporate VR? How we will do it. And then most importantly, probably, how do we integrate that into an existing curriculum and an existing program? Because that's important. We don't want to just take a tool and say, we're going to use this. It's got to fit. It's got to make sense. It's got to improve something for the learners, right? So for us, we're using VR. You can think about it this way. We think about simulation on a continuum. We've got our very physical tasks on this end, and we've got our very cerebral tasks on this end, and everything in between. And so we use things like task trainers and things like that for the very physical things, placing IVs, catheterizing patients. Task trainers are great for that because those are what are called, high frequency, low risk events. But we need to be good at that. And they're very physical, muscle memory related tasks. Other end of the continuum are the very cerebral things. We're in a room with the patient, blood pressure's falling, they've got a dry mouth. Now we find out they're diabetic. Oh my, okay. We got to put the pieces together, right? VR is great for the other end of the continuum because obviously there's no physicality to it. We're not going to get good at placing IVs in VR. But what we can do is we can be beside the bed. We can develop that team communication between the learners. We can develop our communication skills with that patient, and we can develop those critical thinking skills. Because the upside of VR is we can create any situation. We're not hindered by the physicality, having to have a patient in a bed in a room this size or, whatever. We can create anything. We're really not bound by much other than it's this environment. Does that help? Does that address your question?
Absolutely. I think it's more about the immersive abilities to implement those critical thinking tools and, the choices that they make as they navigate those scenarios. So I think that's great to see.
And one aspect we have to consider is that when healthcare professionals go to clinical, we can't control what they're going to experience in clinical. They could be at a site for 5 days and really see nothing of, they might see very, I won't call it mundane, but very everyday type situations. And that's fine. Clinical is important and it's necessary and it's something we need to do. And it develops, good learners and good students and ultimately good healthcare professionals. But what simulation allows us to do is we can supplement that. We can make sure they're exposed to this situation or this patient or this scenario. And one of the common ones, for example, one of the hot buttons these days is MHA, mental health and addictions, right? Mm-hmm. Everybody is having to deal with that. And we know that our healthcare professionals need to be exposed to that and they need to be trained for those environments. Another one is, disruptive patients, disruptive family members. Same thing. They may not see these sorts of things in clinical, but we can certainly expose them to that in simulation environments.
Yeah, and in a consistent way where they have an opportunity to practice those skills and then debrief it afterwards. And
you know what? You're so true. That's the beauty of simulation. We can put learners in an event, have them go through it, bring them back a week later, and put them through the exact same event down to the second, with the only variable being the learners.
Mm-hmm. Yeah.
Wow, very powerful.
It is. And, I think as an educator myself and using simulation, I have a few instances of working with students and them coming back to me and saying, oh, this was a great experience. And here's how, I saw it come to life once I went out into that clinical setting. Are there any stories like that that really stick out for you in terms of how simulation really enhanced their readiness for the workforce?
I've got a couple of things in mind. One is that a lot of students here have said that they appreciate being exposed to different types of patients culturally. And that's a real facet of Bow Valley College. We've got students from 138 different countries here at the college, 16,000 students from 138 different countries. So students are exposed to different languages, different cultures, different ways of looking at things. And when they go out in the real world, because that is the real world, when they go out in the real world, they've experienced that already, right? And again, all these things we do in simulation, the ultimate goal, let's face it, you and I and everybody else that works in simulation, our ultimate goal, it translates into patient safety, ultimately, which is obviously societal good. Yeah. But another factor we've seen is healthcare professionals are having to become intimately comfortable with technology, like it or not. For example, here in Alberta, Connect Care. Connect Care rules the world in the healthcare environment these days. Everything you do in the healthcare environment is probably in and through Connect Care in one form or another. Well, a lot of what we can do in our roles is to familiarize them and get them comfortable with technology, whether it's VR, whether it's using electronic health records, whatever. So then when they go out there in their careers, they're comfortable with that already. And we've heard that already from many students, that they appreciate being exposed to those things in their careers because it's much easier when they go out. It's not such a steep learning curve, and they feel like they're a contributing member of teams from day one when they get out there, their working careers.
That was a perfect segue, actually, to my next question. I wanted to hear from you. What are some of the emerging trends that you're seeing in simulation? Some of the topics. So, talking about digital health tools, are there other areas that yourself and your colleagues are emerging and really diving into to support the education programs?
I think what we're seeing among healthcare professionals is we're seeing the need for, and we touched on one already, MHA, mental health and addictions. Another one is we're seeing, our RPNs, registered psychiatric nurses. We're seeing, needs that are arising as a function of society, and patients that they're going to see in their careers are a reflection of society. And as society changes, the patients change. And as the patients change, the onus is on us as educators and education providers and simulation is to provide education that reflects and addresses those needs. And I think another trend we're seeing is the whole concept of aging in place, right? We're seeing many more people who are choosing to spend their golden years, their later years, in their home environments. Well, so that what that's entailing is healthcare aides are often working in those sorts of environments. So one of the things that's happened is we've developed a suite here at Bow Valley College where we've got a kitchen and a bathroom and such, so these people can train in these environments. And today, guess what's happened? The patient fell getting out of the tub. Now we've got to get them up off the floor, do a quick assessment, right? Because in their careers, they're going to be working in those environments. So let's prep them for that now.
Yeah, that's fantastic. I think, something they wouldn't normally see in their lab settings as a part of their courses, but that they can still experience before they go out and are working with patients one-on-one.
And again, we're getting back to that whole idea of we want to expose those learners to those environments before they actually are out there in the real world working in those environments. Yeah.
Yeah. I'm going to go now into your role as managing within the Sim Center. Can you tell us a little bit more about those critical elements that we see necessary for scaling simulation technology for the workforce training in healthcare?
Yeah, it's funny. There's been a little research done about this in the last few years around simulation in general and simulation programs. And they've looked at and they've found that a couple of the pain points for a lot of simulation programs and simulation education in general is financing, money, and operations. Those are often two pain points for a lot of simulation programs. And so for me, that was one of my mandates coming in here, was to address those two things specifically. Make sure we've got a strong funding stream now and in the future, and make sure we're very tight from an operational perspective. And I think we've accomplished that. I've brought in some great people. I think I brought a different facet to things with my skill set, coming from, I think, a lot of institutions. There might be funding, but maybe it's only contingent upon a grant, let's say, or it's contingent upon support from this particular person in this, high up position. That's something I think we need to address. We need to look at that when we look at simulation programs, because we don't want to set programs up for failure. We want to look at the long term. We want to make it so it's really running well. It's really fulfilling the needs of the learners, right? And if it fulfills the needs of the learners, they go out, and again, we've said it before, we'll say it again, they're confident, competent professionals, and that's what we're producing. That's the ultimate goal.
Yeah, exactly. And once we see that a simulation scenario embedded in curriculum, the students, the staff, they see the value in it and want to be able to continuously have that opportunity. So I do agree that is a huge key area to focus on the continuum for simulation. From your experience, your wealth of knowledge, maybe you can share a little bit of advice for other institutes looking to implement or expand their simulation-based training. What would you recommend to them in those situations?
So I would suggest they consider this. Everything should fall down from the top, and that's curriculum. Curriculum should dictate everything. And then your programs, and then ultimately that dictates your structure, your staffing, your space, and fall down from there. One of the things that I saw in simulation centers all over the world, and one mistake that was fairly common, was implementing a technology and saying, like, one thing I'm seeing right now, for example, AI. Everybody's trying to implement AI. Great. But don't go looking for a reason to use AI. If you've got a situation where you've got a gap, or things aren't running as smoothly as they should, or you think there's a better way of doing this, fine. Then look at AI, but don't go looking for a need for it, for example. And I've seen that again and again. VR. A lot of people went out when VR first came out and bought headsets and then found that they couldn't make it work. A lot of programs have done that because technology, the big part of it is it's not difficult to go and buy headsets or to find AI or whatever. That's not the hard part, the acquisition. The difficult part is the integration and the implementation of that technology. That's the difficult part. And it's got to fit with your curriculum. If it doesn't, then you've got a problem.
Yeah, definitely. I think those needs assessments and really looking for those gaps is great advice. So thank you for sharing that. In terms of continuing education for educators and even healthcare professionals looking to expand their experience and knowledge in simulation, what would you recommend in those areas? Do you have any opportunities that you offer at Bow Valley, and what does that look like?
So, one thing I'd recommend is Simulation Canada has some good courses. They're well worth taking. They've got 3 of them, as I recall. to date, and they're very good. I've referred many people to those, and they've always found them helpful. That's the first thing I would suggest. The second thing is, if someone thinks they might have an interest, come into a simulation center, ask to take a tour and see what goes on, within the walls. And, if you do, then pursue it. I would highly encourage people to pursue it, because we need more simulation centers. We need more simulationists, and we need to expand and evangelize, I guess, the philosophy of simulation.
Yeah. And, in terms, sometimes I see, we have our tried and true scenarios that programs like to use each year. But, healthcare is ever changing, ever evolving. What recommendations do you have to continuously improve and revamp scenarios to make sure that it's aligning with what's happening in industry?
Well, one thing I think that's becoming apparent is that let's say 10, 15 years ago, simulation was largely, we thought of it as patient simulation. Let's face it. The majority of it was patient simulators and beds. It's become much broader than that now. It's AI, it's VR, it's all kinds of things, virtual, it's all kinds of things. And I think we're realizing that modalities, let's say, because, for example, people come to me and say, oh, VR, that's simulation. VR isn't simulation. VR is a modality. It's a way to do simulation. Simulation is a philosophy. It's an approach, whatever you want to call it, but that's what it is. It's the overarching environment, I guess, teaching environment. And what we are seeing is we're seeing that some modalities seem to be better than others for teaching certain things. And we've just finished a study looking at the same event. It's a hypoglycemia scenario, and we ran it in patient sim and we ran it in VR. And the data is still coming out, but it's interesting. It's very interesting. It's going to show some promise about. It's the beginning of looking at maybe where we're going with this. What tools are the best for teaching what, and what group of learners at what points in their career. I think we're going to get there, and we're going to start to nail some of the stuff down.
Well, we'll look for that study. I'm interested to hear more about that. Thank you. Well, Roger, I really want to thank you for joining us today on the podcast and sharing your expertise and your recommendations for those branching out into simulation. We really appreciate, the work that you do within the community of simulation and, at Bow Valley College. So thank you very much.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.